6 years is more of clinical. 6 years is more of clinical. In India, I had a clinic, and later I was working with one of the clinic in Singapore. So I have treated various disorders. Like I have kept on seeing the question Q&A sessions with all of the doctors out here. So they are wonderful, and in that they have covered almost all the disorders. And my expertise is more into diabetes and skin disorders and other diseases as well. But that is my more expertise. And this is the short and simple introduction about myself. And I'm very new to Ireland. And thanks to Noel and Dr. Dawn for taking me into Ayurveda Center. I appreciate that. Thanks.
And I think it's wonderful to have you with us on board. It's fantastic. It's very good for the country to have an extra Vaidya, promoting Ayurveda, and somebody as good as yourself. So we're really pleased. But I would like to illustrate to you how educated our audience is. And what I'd like to do is ask them to put in one word into the chat line as to what dosha predominates in our new doctor, Chitrali.
That's a tricky question, Dan.
Well, let's see what people say. Oh, look, already they're coming up. Florence says kapha. Kapha, majority kapha. See how good they are. See how good they are.
So they're experts, even without taking the pulse. They're giving a.
Oh, yes.
Well, it's always very, very difficult to tell, but it's yeah.
And kaphas always have that wonderful, strong personality and gentle, kind, easy nature, so it's nice to have that, because we have plenty of pitta in our team and plenty of vata, and we can do it in the kapha.
That's for sure. I need something to balance the pitta down, all right, yeah. Kaphas is very sweet, very soft-spoken and all that, so it's a nice balance. In actual fact, it's very interesting that diabetes is one of the areas that you specialized in, So I think diabetes is, I think it's becoming a bigger and bigger problem in the Western world. Probably, certainly in Ireland, it's becoming a bigger problem. So I think maybe in the autumn time, this is not the time to be doing any really big promotion at the moment, because with the sun out and people at the sea, people are not really concerned too much about their health. But certainly in the autumn time, I think maybe we can take a look at doing a webinar or something like that on diabetes and from an Ayurvedic perspective, because I don't think it's one of the ones that we've actually covered, So anyway, yeah, so feel free to join in in the Q&A tonight. There's some questions coming in. And
and Kerry asked.
Hello to Chitrali. Hello, Chitrali.
Hi. Hello, Dr. Rajvinder and Dr. Nahid. Yeah, nice to see you.
Yeah, we'll all meet up together. It's unusual that we haven't all met up at this stage, but I suppose with COVID and everything that's going on, it's very difficult for us all to be meeting up together, and with Dr. Nahid being in India as well. But our aim, as you know from speaking to us, is like my personal aim is to make Ayurveda as popular as Western medicine, and get this knowledge out there. So I don't care if I have 40 Vaidjas or 400 Vaidjas or 4,000 Vaidjas. The more the merrier, as far as I'm concerned, because we just need to get this knowledge out, and there'll be no resistance from people once they realize what this knowledge actually is. If they don't have an understanding of it, if they've been told wrong things, if they believe it's not evidence-based or it's not practical or whatever, fine, they're not going to go for Ayurveda. But when they actually begin to realize, well, what is actually Ayurveda, and they begin to see how profound it is, and the different diseases that it can treat, then there's no reason why there can't be Ayurvedic doctors everywhere, in every village and every town in the country. And that's where the Ayurveda Center wants to go. We all want to support each other and just grow the business and make it as big as possible. So it's great to have another doctor on board. And Dr. Chitrali is living in Grand Canal Dock in the middle of Dublin City, So we'll organise to make consultations available with her. Probably not in person to start with, but maybe over Zoom. But I think maybe the first thing we'll do is we'll do a webinar later on in the year on diabetes. We can make it from there,
Sure.
And Kerry asks, what's the maximum limit of questions to ask? There's no limit of questions, but there's a limit in the amount of answers. So we just work our way as far as we can. And there's two questions related to vaccination. And my suggestion was that the vaccine that was probably more tested than any of the mRNA or DNA vaccines is coming. It's called Valneva, and it's undergoing trials which should finish in August and would go for the European Medicines Association approval in September. Already the English government have bought 100 million of these. These vaccines, Valneva, will be the old technology which has been producing vaccines for the last 40 years, so it's tried and tested. Whereas the mRNA vaccines, we don't know the long-term effects of, and we'll only find out in the next 2 or 3 years or in years to come. So it's just, I always prefer the tried and tested than the novel, because we always have more knowledge about the tried and tested ones. The other question, what can you take for blood clots post-vaccination, Jacinta? The thing there is that if someone had that terrible problem, it's like ractoshodin, a purification of blood that would require a one-to-one. But what would be a good preventative actually is just simple turmeric. Turmeric is, as it were, excellent for thinning blood. So I would add lots of turmeric to my diet with a little bit of pepper, and that would be a prevention that would be useful to use if you were getting a vaccination. Okay, maybe someone else will add to that. Any of the other pages?
Yeah, as you said, it's one-to-one really. If the blood clot is there, you're having symptoms, your first call is your GP, they get you tested, and I'm sure you need, it's symptoms, depends on what symptoms you're getting. But just to prevent, like, yeah, as Dr. Bryan said, turmeric, ginger, rosemary, thyme, chives, one of those herbs you just use in your everyday cooking and keep your blood flowing properly. So it shouldn't be a problem. So you just keep your blood thin with all these wonderful herbs out there.
Any of the other pages got any question they want to answer? Or Rajvinder, have you? Or I take over?
Maybe we answer one by one in the queue, yeah. Somebody at Naid goes and then maybe Chitrali go.
Oh, okay, Naheed, you go ahead.
Yeah, thank you. So this question is a very long question regarding 2-3 different issues. So the person says that she's of Vata and Pitta Prakriti and she's having a lot of burps and indigestion problems. So she actually wants to know that what's the problem. So when you have a lot of burps, that can be because of, the Vata is going upwards, so Vata is imbalanced. Indigestion can be because of Vata, Pitta and Kapha. Based on your symptoms, I would say that Vata is the most responsible factor in your case. What you can do is you can boil 2 or 3 cups of water with some caraway seeds, which is also known as ajwain seeds, and you can sip that water hot throughout your day. That will keep your vata in the lower part of the body where it has to be, and there will be no burping sensation. And then regarding your gallbladder scasis, I would say that you need to focus on more of a pitta balancing diet. We have something called liver care syrup. You can use that as well. And musta. Musta is a very good herb to balance your pitta. So you can have a half a teaspoon of musta before your midday meal, because midday is the pitta time. And try with liver care syrup as well.
Chitrali, you want to take a question?
Chitrali, go ahead.
Okay, yeah. So there's one question related to arthritis. So arthritis caused by accumulation of Amma. And if Panchakarma is not available, what is the best way to get rid of Amma? So see, arthritis, there are many types. So according to Ayurveda, there will be like Vata related, or it is more predominant with Kapha or Pitta. So according to the doshas imbalance, we have to decide what kind of Panchakarma we have to give. Not all arthritis need Panchakarma. So main thing in arthritis is to get rid of Amma. So the best thing is like you should have cumin or cumin and coriander seed water in the morning, or in the daytime warm water, which is with a decoction of cumin and coriander seed water. So that will also help to reduce the accumulation of Amma. But for arthritis, what type of arthritis it is, we have to first see. There is no in general solution for that. But yes, if there is no inflammation or no swelling over that part, and if it's only pain, then you can apply few vata shaman oils are there. Then even you can do hot fermentation, or even dry fermentation can be done. So it depends upon what kind of dosha is involved in that arthritis.
Yeah,
Hope
and
I'm
actually,
clear with this.
yeah, no, that's very clear, actually. Just a few things there, just in case anybody doesn't know what Amma is. Amma is toxicity, and it comes from improperly digested food. And basically, there's two products of food. One is ojas, which is bliss and vitality and happiness. The opposite end of that is Amma, and Amma is toxicity. So you get that from eating bad food, heavily processed foods, reheated foods, the wrong type of foods for you. If you have a very weak digestion, then your system can produce Amma, and it gets lodged in joints and causes lots of problems, not just arthritis. Now, we did do a webinar on arthritis, a full webinar on it. So you can go, and it's on our website, ayurveda.ie. You can rent that whole webinar on arthritis. And Dr. Chitali is correct. It depends on, really, we need a diagnosis of the person to find out, well, is this associated with pitta or is it associated with vata? And then there's treatment protocols depending on which type of arthritis it is. But we dealt with nearly all of them, I think, on that webinar, Dr. Brennan, didn't we? We went through a lot of different forms of arthritis. And
absolutely, we did three primary ones, but we connected in all the others.
Yeah,
you know, we did in terms of Vata Pitta Kapha, which is the Ayurvedic perspective.
Yeah, so I think anybody that is or feels they're getting arthritis, or maybe already has it and is looking at different treatment options for it, it would be well worth your while to look at that webinar. And then if you feel that it's something you'd like to embrace, because it's like all Ayurvedic treatments, it's up to you. The doctor just gives out the knowledge. You have to apply the knowledge. You have to make the changes. If you're not willing to make the changes, then everything's going to stay the same, So, and then if you feel that, the Ayurvedic approach is something you'd be interested in, then I'd advise having a consultation with one of the doctors to get on a proper program, because arthritis is something very serious and very debilitating, so it needs to be treated in a very serious manner as well. There's a question I got on the email from Elfried Grida, and it says, what is the thinking in Ayurveda about dead teeth in the mouth? I think we're back around to you, Dr. Brennan, so maybe you can tell us about dead teeth in the mouth.
About which? Dead
teeth in the mouth.
Oh dear goodness, God love them. Teeth are a vata problem. Bone is a vata tissue, and so teeth are related to bone and are vata tissue. And nerves also tend to involve a lot of vata. But certainly I would be doing the daily oil mouth rinse. So that sesame oil in the mouth is very good for vata and nourishing. And it also reduces the oral bacteria throughout the day, so it's very good for oral hygiene. If the tooth nerve is already dead, I would find it probably it might not be reversible at this stage, and so the best advice is to get the advice of your dentist. But you should be doing a lot of measures to balance your vata and to strengthen your bones from an Ayurveda point of view. And I think I heard another Vaidya coming in there.
Yeah, Dr. Naheed, I think, has something to say there.
Great.
No,
he didn't. Okay. Yeah, so you're saying, Don, if the nerve is actually dead and the tooth is completely dead at this stage, you're not going to bring it back to life.
I would doubt very much.
Yeah.
I mean, everybody's unique and every condition is unique, and who knows, I mean, there may be some possibility for that particular individual with the balance of that and the nourishing of the bones and the nourishing of the nerves. But in any sense, I would start to do that for prevention.
Yeah.
Not for this tooth.
Yeah, exactly. Dr. Naheed did a webinar. I mean, it was a fantastic webinar earlier on in the year about oral hygiene. Well, it was eye, ear, nose, throat, and skin, but part of it was about oral hygiene. And the thing I find amazing is, like, if I talk to Dr. Rajvinder, Dr. Rajvinder doesn't have a filling in her mouth. There's absolutely no fillings, and you don't get that in the West. People are. I mean, when I was a kid going to school, we were being brought off to the dentist, and I don't know why they were filling how our teeth got into such a bad state so early, but they seem to be just putting fillings in all the time. And so you end up at the age of 21 with a mouthful of fillings, and then, missing teeth. So it's probably the very high sugar content that's there. But that definitely doesn't have to be the way it is. If you look after your teeth, they can last you a whole lifetime,
And Chitrali, I would guess Chitrali has perfect teeth, but we know also that Naheed has no teeth filled as well. So
yeah.
it's just a very
Indians normally, because that culture wasn't there. I hear from my patients, they say they were paid, I think, 10 euro to get their teeth out or something. So lots of them lost their teeth in a young age for no reason. So that's why in the West it's just something to do with the dentist or whatever.
It's also to do with sugar.
Yeah.
Sugar.
That was the other thing. When the sugar came in Ireland, I hear from patients, they tell their mother used to put sugar on everything, even sugar on banana and so on. The sugar was really forced to enter into the house.
Listen, I remember having sugar sandwiches for me tea when I was a kid. I think if my mother had a particularly busy day with 6 children, we were given sugar sandwiches. Didn't happen that often, but I do remember it happening,
And you loved it. You loved it.
I probably did. I also think there was.
And we never had bread in the house as a child, so I think there's a lot of cultural food differences. So that's probably.
Yeah, but if people are interested in looking after their teeth, I mean, it's never too late to make changes, So the oil pulling is definitely something you can do. Use herbal toothpaste. We have the gum care oil now as well, which I'm getting rave reviews about from people with the gum care oil. So do have a routine every single morning where you do the tongue scraping, you brush your teeth, you do the tongue scraping, you do the oil pulling, you use the gum care oil if you feel it's necessary. And that way, and then obviously you clean your teeth later on in the day as well. I mean,
it's something like scraping your tongue seems like a thing of nothing, but the truth of it is that it's been associated with an increased production of nitrous oxide in the mouth. And this nitric oxide is vasodilator, so it opens up the circulation, and that will nourish the tissues of the mouth. So, I mean, these traditional practices are finding increasing validation in research. There was another question on ropina oil, and ropina oil is an oil that's used in Maharishi Marma treatments, and it's for applying basically to scars and to, enliven the energy around those old wounds. So that's what you would use the ropina oil for.
Is that 3508, Don? Is that similar oil to 3508, the skincare oil?
No, it's not a skincare one. No, it's from Oshadi.
Oh, it's from Oshadi. Okay.
Yeah.
So we wouldn't have that, but you could just Google Oshadi and ropina oil. How do you spell ropina?
There could be different ropina oil, not from Oshadi only. She might got it from somewhere else. Then you can use it on scar tissues, or if you have any wound or anything. But yeah, make sure you have a good source. So I don't know which one she has. It may not be the Marma oil, but Dr. Brennan is right. It's used for Marma points to improve the energy and mainly on the scar tissues. So I don't know which ropina oil she has. There are lots of different ones. We don't sell it. Yeah.
Do you want to take a question there, Dr. Rajinder?
Yeah, I'll take a question from Regina. Regina said she's back on training. Happy to hear that, Regina. And what can she take for her muscles and strengthening the bones? We have spoken about calcium care supplement before, Regina, so I definitely recommend that. And because that helps with the absorption of calcium for the bones in the women in their 50s. And then even from 40s, you can start that. And then amla berry, if you are doing more intense training, then do take amla berry, because amla berry will help with the lactic acid deposition in the muscles and would help with the soreness that you get after the exercises. And so those 2 products for sure. And hydration, all the normal rules. So you're a Pitta Kappa woman, so you can go with the training. So yeah, so try those 2 products for sure.
Okay, I put those both into the chat box because people were saying before they didn't know what they were. So MA925 is the calcium care, and MA1 is the amla berry.
Yeah.
And Dr. Chitrali, is there any question you want to answer there?
Dr. Naheed can go.
For Dr. Naheed?
Yeah.
Yeah.
Have you any questions?
Lots of questions in. I'll start giving them to you if you can't pick one.
Or maybe
Okay.
you can take one as well.
I take a question of my favorite food category, that is fruit. So the question is that whether a fruit can be taken like banana with the dairy products. So no fruit should be taken with dairy products, because when we digest a food, most of the fruits are turning to the metabolic effect are sour, and the metabolic effect of milk is sweet. The sweet and sour doesn't go nice together. They can be a detrimental combination. So you should always avoid having fruits with your dairy products. Like some people are like really used to of having a smoothie full of vegetables and fruits in them. Avoid that. A lot of people is also used to of having a porridge in the morning with blueberries and raspberries. So you know that raspberries and blueberries are citrus, so they are sour in nature. You cannot combine sour fruits with dairy product, right? And also, when you make a fruit salad, it should only be fruits. You should not mix fruits with the vegetables, right? Like some of the carrots and lettuce and with some of the fruits. There should only be fruits, but do not try to add a lot of color. Okay, so choose a category of fruits. So if you're eating citrus, so take 2 citrus fruits and just 1 sweet fruits, like it can be an apple or pear. Too many numbers of fruit, too many combination, it's not a good idea. And based on your body type, which fruit goes well with your body type, you can combine them like 2 or 3, not more than that.
Okay, Chitrali.
Yeah. Shall I take the question? So, Mitchell has asked the diagnosis. He has a diagnosis with diverticulosis and looking for a recommendation for food and medicine. So diverticulosis, it is a bit tricky. So just continuing with what Dr. Nahid just explained about the food habits. So we have to like look on to your food habits, what kind of food you are having. It should be mild and easy to digest. Firstly, like keep your clock, means you should wake up early, have your breakfast, have your food and lunch and dinner on time, and whatever you are having, it should not be in a raw form. So no raw salads, which are very hard to digest as well. And even the fruits which you are having at a time, have only one kind of fruit. Don't mix the taste of fruits into that. And the other thing is, try to have whatever is like the food grains like rice or dal, whatever you can have, you should make it, cook it well and then have it. So these are the few changes which you should do when you have these symptoms, when you have diverticulosis. Anything else to add into that?
There are very good herbs. So if it's really bothering you a lot, if it's the symptoms are really kind of acute at the moment, I'd say the personal consultation will be very helpful, because even just a fennel tea or reducing nightshades from your diet, or the diverticulitis can be provoked by fiber, too much fiber in your diet. And just one product, Trifla, could be very good as well. So make sure you have a regular good bowel movement, or just taking a happy teaspoon of Trifla in the water. That could help as well. Dr. Nahid mentioned, or Dr. Chitrali mentioned, cumin, coriander, fennel tea. That is good. Dr. Dawn, you want to?
About what to do when the GP refuses to do tests, where can you get those tests? Well, the way our health service works, actually, the tests are generally done through GPs. And the only, I suppose, way is to find a GP who's open to your suggestions, and see if a different GP might actually be prepared to do more of the tests that you're thinking about. Sorry about that.
I think she's saying, what test is it? So
she's thinking about adrenal fatigue and other.
The saliva test could be very good to find out the cortisol level in the body. So get your normal blood and saliva test done. I think they're doing that anyway.
If you won't order, there is an independent laboratory in the UK.
Yeah.
You remember the name of that one?
Yes, you did mention that before. It's not a. Yeah, you can find it. You can email it.
There was one in Dublin, I think, but it closed down. You were telling me about that, Dr. Brennan, were you?
Yeah, that was in Sandyford.
But GPs are doing tests now. The patients are getting their tests done.
It was closed. They were from Eastern Europe. They
Okay.
sent us off to Eastern Europe.
Okay, I might have to take a question. I missed it. There's a question. I have to look at a question to pick it. Somebody asked about the shingles. Can the shingle be treated with Ayurveda? Yes, shingle could be treated with Ayurveda. I think with the heat in the environment, these things are coming on the surface. So try to balance your pitta. So look into them. Pitta balancing food. So as Noel was saying, some of the pitta food, like it depends on if you're vata as well. I'm not going to say salad, but a bit of salads, hydration, coconut water. We have oil skin soother, MA3508. So application on the shingles, because skin get very hard and they could be very painful. So you can apply that. Application of ghee is brilliant. So you warm up the ghee and apply a couple of times a day on the shingles as well. And just a simple herb, I think MADK2, that can calm down the heat and that will help. So these are the two recommendations I can give. But if it's very severe, if it's on the nerve ending causing nerve pain or anything like that, you talk to one of us. I think that will be better to get a broader picture of what's happening there.
The laboratory is Genova Diagnostics, and the website is just gdx.net.
And stick that into the chat box, Don, if you wouldn't mind. Lots of questions coming in there.
No, Dr.
We're falling behind.
Quickly, we are going in a row, so maybe the next doctor can catch up quickly. So
yeah.
And Nahid, that's you to go now.
Yeah,
and Don,
so
you get ready.
Already pick your question and we're ready.
Dr. Rajvinder is also working as a moderator. She's helping us to do question like
Yeah, no problem.
Which dosha is responsible for urticaria? Is it a pitta condition? What can be used for the treatment? It's a pitta condition along with kapha as well. So that is called as in Sanskrit term Shita Pitta. And a very good medicine is available in the form of turmeric. So turmeric is processed in a specific way to make medicine. So what you can do, you can use turmeric in your food, like when you make your curries or vegetables, or you can use that in if you used to of having milk, then you can add a pinch of turmeric in your milk. Otherwise you can have turmeric just like that, with hot water to prevent further increase of your urticaria. Along with that, we have very good herbs as well, like manjishka, like neem. You can use manjishta neem as well to reduce your urticaria situation. And for local application, you can use coconut oil. Coconut oil is very relaxing for pitta, and that soothes your skin, so the itching sensation and the rash will reduce. And you can also apply aloe vera gel as well to soothe your skin rash stuff. Is there any other herb which you recommend, Dr. Rajvinder, Dr. Brennan?
Allergard.
Yeah.
Give the number if you. I may 17.
I'll put it in 1778.
Yeah.
So my turn. John C.
Chitrali's turn.
No, it's Don's turn.
Chitrali's.
John C. asked about low back pain. John, I would suggest a sequence of yoga postures that you'll find in a book called Mind Your Own Back. Mind Your Own Back, by a man called Steve Timms. It's a very simple approach, but very effective. And Somebody asked about strength training. They're going into starting strength training. 2 herbals I'd recommend would be ashwagandha and amla, because they support muscle metabolism. Ashwagandha and amla. Amla is also the MA1 tablet. That's specifically produced in a traditional way, processing the amla 20 times in its own juices to fortify it, you know. And then the third one I deal with, because we need to get through these questions and answers, and every doctor should take 3 questions and go quickly, I'd suggest. Anyway, the third one is about anxiety, lack of confidence, and negative thoughts. Now, the essence of Ayurveda is that we are consciousness manifesting a physiology. We create, construct, to become our bodies. And in the process, in our culture, we are trained to look out and we lose touch with our essential nature of most profound inner being. So the best strategy for handling this complaint is to get back deeply in touch with that stillness of mind, that settledness, which is our essence. And that technique that's best for that, in my experience, and the scientific research is very supportive, is to practice transcendental meditation twice daily. If you do that for a couple of months even, you'll find your anxieties abating and your strength, your inner strength, and your confidence growing. tm-ireland.ie will be the website to go to if you're in Ireland, tm-uk if you're in the UK.
Hi, Raj, you're on.
It's Chitrali. Let her take.
Yeah,
Okay,
Chitrali.
We missed her.
Yeah, okay, I'll take one. So, Yash Bansal has asked about female infertility. So, at the age of 36, it's primary infertility, and there isn't sufficient graphene follicle to produce eggs. So, anything in Ayurveda can help her. Yeah. So, there are quite a bit of herbs for this to improve the egg quality, basically. So those are like Shatavari, Ashwagandha, and there are few proprietary medicines as well, which is like Sukumar Gritam, or even we have Dadimadi Gritam. Do we have in our list Dadimadi Gritam?
No,
No.
we don't have a Gritam
Okay.
preparations.
So, okay, so Triphala Grita, we have Triphala Grita in our.
No, but the person can prepare if you just explain what
Okay,
that.
okay. So we can explain you how the ghee can be prepared, and that should be taken empty stomach in the morning and at night according to your dosha dushti. So once you have a good consultation with the doctor, so we can help you with good herbs. And I have treated one of the case who had poor egg quality, and her extraction, like she was going to go for IVF, and the extraction of eggs were fantastic after 4 months of treatment. So it depends upon case to case. So you can go ahead with consultation, and doctors can help you out with that.
You could recommend Shatavari. That's what we have, and she can start on that on Shatavari now, and it's available.
What about MA3347, Ranjinder?
Yeah, that's the other one. Yeah, that's where you get into detail about the cycle and everything. Yeah, that could be another very good product as well.
Mm-hmm.
So do you want to take another question? So
I'll just take one more.
Yeah, go ahead.
Yeah, go ahead.
Yeah. So Jackie has asked about treatment for early onset of cataract. So for early onset of cataract, we have a wonderful treatment called as Tarpanam. So I'll just explain you in a very short way that the eyes are covered. Both the eyes are covered with a kind of
it's like a ghee bath.
Like a ghee bath. So the ghee is instilled into your eyes, and there are few exercises which you have to go through that. It is a half an hour to 45 minutes treatment, and the results are wonderful. Like it rejuvenates, and it stops the degenerative changes which are going on in your eyes. So this is a wonderful treatment, Tarpanam. And even internally, if you take Triphala is also a good herb to help for your eyesight as well.
Yeah, I did that treatment, the netratarpana. We did it in India when we were doing Panchakarma. I did it a few times actually. It's very, very powerful treatment. Yeah, so, and then you have to open your eyes underneath, you know, and when the ghee is in there, it's kind of a little bath that's on your eyes, and it's very, very nourishing for them.
But the person can do the ghee massage at home.
Yeah, ghee massage at home.
Access
well.
to the treatment, yeah.
Correct. So
Okay.
just, yeah.
Yep. So whose turn is that?
You,
Okay,
Dr.
I
Rajinder.
just take a quick question from Gene Per. He said he got a knee surgery and there's a scar on it and he's applying pseudochrom. From Ayurveda point of view, the Suropana oil, the skin soother oil, or you can apply castor oil. Castor oil is great for scars and healing and the marks and everything. And castor oil will help with the knee after surgery as well. So apply local application of castor oil. And something for eczema inside the ear, but you have to treat the eczema through your diet. So it is a pitta. So you need to cut down on the hot, sharp, spicy, acidic food from your diet. And then back to a radiant skin is a very good herb. You can try that as well.
So question, Chyawanprash. Yes, Chyawanprash is a great tonic and good for someone with COVID. So highly recommended. And the question on epilepsy following skull damage, then that's a real Vata type problem. And there would be a lot of advices about balancing Vata and about strengthening your nervous system generally, and perhaps herbals as well to help that excitation. But you know, some things there's no home remedy for significant conditions, which is why, you know, the possibility of consulting when you have significant problems. Like Alison talks about her diabetes and her anxiety and her PMS. And thank you for sharing, Alison. And again, it's slightly complicated because, you know, diabetes can be a Kapha or a Vata problem, but the anxiety and the PMS are definitely Vata problems. And moving to balance Vata through a really good routine with adequate rest and relaxed meals and things like meditation, massage, taking a day's rest on the day of your period is a significant one, Alison, for helping your cycle to settle with that PMS. And then there are herbals as well. There's a ladies tonic, ladies Rosina, MA 3337. That I would take a tablet, you know, before each meal.
Dr. Brannon, wouldn't menopause support too will be better? She's PMS, not menopause. Yeah, sorry.
Yeah. So depends on her age too, doesn't it? So yeah.
Yeah, I think Ayurveda emphasizes very strongly about not overdoing things during the menstrual cycle. You know?
A Shokarishta will be very good.
Yeah. Do we have that? Do we have that?
Yeah, we have a Shokarishta, yeah.
Shokarishta for PMS, it works wonder.
And rest when you have, as Dr. Brennan says, on the first day, but even the second day and third day, if you can as well, to whatever extent you can, but certainly don't take on extra activity at those times. You know?
So
Naheed has stirred the storm about the fruits and fruits and dairy. This is probably hard to hear and hard to say.
Huh?
About the fruits and dairy products. People are shocked.
About mixing fruit and dairy.
Yeah.
Yeah.
Okay, Dr. Naheed.
So yeah, I saw a question regarding migraine, but I lost it. So I answered that question only. So migraine is a condition where your Vata, Pitta, and Kapha both are in trouble. All three of them are in trouble. There is actually a blockage in your channels. So there is a pain in your head, in your eyes, in your brow bones, and sometimes in your temporal region. So with the diet, you can have more of a cooling diet because migraine usually increases more in the daytime as the sun intenses, your pain intenses. So try to have something cooling like coconut, like watermelon. Keep yourself hydrated. Keep yourself away from coffee, tea, and chocolates because these things can increase the pain. And some people are like really sensitive to smell, fragrance. So keep yourself away from the very intense kind of perfume or body spray. And regarding herbs, you can have herbs like trikatu, which will help to cleanse your channels. There is you can make your milk with ghee, because ghee and milk together will help to balance all the three doshas. So these are the simple measures you can take to reduce the pain intensity, but I would definitely advise to take a consultation before you start. And nasya is a wonderful thing to balance your all the three doshas, and will help you to reduce your migraine pain and all other kind of headache related disorders.
I'd add one thing to that, and I would say meditation can be fantastic for migraine. My experience of teaching it is meditation is like a migraine. It's just like an electrical storm going on in your head. You notice my experience is very much associated with stress, and meditation, that ability to give your mind that deep rest, even if it's just for 10 minutes or 20 minutes, it can have a very profound effect on it. So, and obviously anybody who ever had a migraine never wants another one. They're just really horrible things. So definitely everything that Dr. Naheed said, I'd agree with, but also meditation is well worth taking a look at it.
Jacinta has, no, go ahead.
Sorry. So there's a question about bloodshot eyes. So in today's time, like the bloodshot eyes can be the reason if you're spending a lot of time in front of the screen or in your mobile phone when the light of the house is dimmed or is just turned off. So if this is the reason, then reduce your screen timing, give yourself some break every 20 minutes, like you look away from your screen for 20 seconds as far as possible. You can make your own decoction with triphala or with licorice, and you can wash your eyes with this, or you can simply soak triphala overnight in hot water. In the morning you strain it and you just wash your eyes with that. That gives you a soothing effect, and the redness will decrease. And you can also do ghee massage, because redness or anything like that is because of pitta, and eye is the organ of pitta. So if you do a ghee massage, that gives a kind of relaxation to your blood vessels, and that can reduce bloodshot eyes.
Yeah, the netratarpiner we spoke about there a few minutes ago is excellent for that.
Hopefully the blood pressure is okay. Just to add into that.
Yeah, okay, so check your blood pressure. Dr. Brennan, you were going there.
There's somebody complaining of a runny eye, and often when the eye is runny, it's because the little drainage tube from the inner part of the eye to the nose is blocked. And so it's something that sometimes if they go to the GP, they might get a referral to an eye specialist who would just unblock that, but through a little procedure. But the other thing you can try is it's toxins that block things. And we have the nasal oil, the MA 735 or MP16, and a little drop put on your finger. Noel doesn't like me doing this and putting it up my nose. I think it's very inelegant. But that's the way you do it. But there's a little dropper. You can put the nozzle of the bottle up your nose and put a drop up and a drop up, and then sniff it up. And your nose tends to run a little after it, which is because it's clearing the toxins, but it does tend to clear the debris from around this area. And so doing that on getting up in the morning and after meals would certainly be worthwhile for a couple of weeks to see if that just helps you to clear it out.
Okay, well, on lesson 5 of the 7-lesson series, the daily routine, I do a demonstration of the nasya with the applicator for putting it on your nose. So I'm sure most of you have seen it, but it's on lesson 5 anyway. And nasya is just a brilliant, everybody should be doing nasya every single morning. And it's just a great way of keeping this whole area clean. And the nose is the gateway to the brain. So it's a fantastic therapy to do. And the MP16 we sell comes in a little applicator, so you can just squirt it up the nose and then just inhale it back in. So Dr. Brennan, I have one more question for you before we move on. This is someone who said they had radiotherapy and they're unable to produce semen. So shukra dosha. I know there'd be certain foods, but maybe you'd have some other advices on that.
Yes, I think
Vital Man herb.
Yeah, the Vital Man herbal, and also the MA631 is a tonic for men. So those two, the 631 has the benefit of stimulating all the metabolisms down along that Ayurveda recognizes where the nutrients are transformed again and again and again. So the 631 will help the flow of nourishment through all the tissues down to the reproductive tissue, and then the vital man will be a bit more specific for the semen itself. But it's not only a matter of herbals, it's a matter of, you know, the whole Ayurvedic approach that, you know, you should have a good routine with good rest. You should have really good nourishment. There are, as Noel says, foods that are particularly nourishing to the reproductive tissues. So I think, you know, take an interest in the Ayurvedic approach, because the medical approach may not have a lot to offer you in that situation. And it could be that the Ayurveda would make a difference.
Yeah, I just want to say something there, Don, because as you know, I'm doing this Ayurvedic and postgraduate degree thing at the moment, and we actually covered MA 631 today in the course. And Dr. Gordon, I was gone. She really loves that herbal. There's two herbals she really loves: MA 1402, which is also Dr. Rajendra's favorite herbal, I think, and the MA 631 for men. But she pointed out, and very, very strongly on this, she said if people aren't willing to get the routine and the basics right, the herbs are not necessarily going to work for them. They have to get the basics right, and the basics being early to bed, early to rise, eat when you're hungry, main meal in the middle of the day, all of the things that we covered in that course, you know. And even by doing that, even without herbals, it can have, or without treatments, it can have a profound effect. But definitely just taking the herbal on its own and continuing on with the previous lifestyle that you had and not making any changes, it's probably not going to make a huge amount of difference. So get the basics right. So for anybody that needs to know what the basics are, again, that lecture number 5 on the daily routine, and that's Dr. Brennan, Dr. Rajendra, and Dr. Naheed go through the daily routine there. So that definitely a video that's worth looking at, you know.
If you don't have time, that doesn't mean you can't take herbs. Blissful joy work wonders. So
if you don't have which?
If you don't have time, some people would say, I don't have time. They're like, one of the person is sharing there, they don't have much time. So that doesn't mean you can't take herbs. Sometimes herbs make you to do things. I hear that from patients as well. It's great to do your routine. It's great to return to the basics and all. You benefit a lot. Then you don't need to take herbs for long term. But if you're feeling like exhausted and tired, like one of the person, I have to see the name, you can start the herbs and then slowly, one step at a time, and start adding things into your routine.
Make the changes, yeah. But do have the desire to make the changes to get there for a healthier life, because you'll run out of time soon enough if you don't look after yourself.
Yeah. Two people asked question on Takra. I'll take that. So Takra is the buttermilk. One person, I think it was Sally, said she's churning her butter from the milk, I guess, and whatever is the leftover is called Takra. So that is very kind of a liquid and thin form of buttermilk that we get here in those containers, Tetra Paks. So the one in the Tetra Paks, the buttermilk will still be very heavy. So you need to dilute it. And the one, if you're churning the butter out of it, then the liquid form, it's very medicinal. So that is used for digestive purpose. If for people with very sluggish metabolism, if you're having too much of kapha, because it will be sour, it will be astringent and sour in taste. So sour taste is good for Vata people. So it is helpful for Vata people in that sense. And because of the astringent properties, also good for kapha people. And Takra is only one liquid that is allowed to sip with your food, or you drink it with your food. Normally, it's not advised to take too much water with your food. So it is great for Vata and Kapha people. In moderation, it's also good for Pitta as well, because it does help to calm down the heat from the body, especially in the summer. Takra is brilliant. So you can make Takra sweet, you can make Takra sour, you can make Takra salty, depending on what you're adding into it. Maybe not sour, it's already sour, so sweet and salty. So the medicinal properties, because of the taste in it, it helps with the Vata and Kapha, and it could help with the Pitta as well. So that's the one dairy product then Kapha people can take as well. But I think Anna said she just sipping Takra, but not in the evening. Takra, yogurt, milk products, better to take in the daytime. Don't take it in the evening, because these sour products, yogurts and all those things in the evening time, they don't digest very well. So it's better to have Takra in the daytime. So it's very cooling in that sense. It's a great cooling drink in the summertime. So we recommend. So somebody was asking about the colitis. So if you can make a lassi, traditionally lassi with mint or rose petals or a little bit of black salt, things like that, that can help with the IBS and digestive problems and all of that. So then the question.
You haven't had Citrali for a while.
Yeah.
I'm just looking for the question.
While she's looking, I just take this question. Is just leading to my own takra thing. So Jean is asking how to remove butter from the buttermilk. So you churn it with those churners, or I think there are electrical things available. Maybe Sally, you can share your experience how you're doing it. In the old time, they used to have manual churners, but I think the one of those, what you call them, you can use with your hands, and the butter will be extracted. And then it's mainly yogurt that you do that, and whatever by adding water, and whatever is left is takra.
I have a question for Dr. Chitali because she mentioned skin diseases. So what would the doctors advise for eczema inside the ear?
I already replied to.
Oh, did you do that one already? Okay, sorry.
So Dr. Chitrali,
Yeah.
bless us with your wisdom.
Dennis has asked, what treatment would you suggest for a housefly bite? Is there any way of preventing insect bites? So when it is housefly or any flies, so usually they are allergic to very strong smell. So you can apply oil. It can be a coconut oil or any medicated oil, which keeps you away from that. And the other thing is like, that is the only anyone wants to add into that, like any other creams we have in our
I've heard basil oil is something they don't like.
basil oil is also okay. Any strong oil, even the eucalyptus.
I can say neem oil, but that will probably your family member run away from you.
Yeah.
So the neem powder, put the neem powder in your bath, in your shower. You can rub that. That's probably less smelly. Neem is a great insect repellent. So burning sage, burning basil, burning one of those leaves. What you call them? The one that we use in the cooking, bay leaves. They're easily available in the gardens. You can burn them if you have too many insects or flies around the house.
Yeah. Or even the camphor also, if you have
camphor.
Well, Noel would have loved to hear all of this a week or two ago before he went up to Donegal and got devoured by these horseflies.
I did get devoured by them. All right. I needed a neem tree with me to keep them away.
We had what we did. We burned the barbecue. Luckily we were camping last week and there were little insects, so we run the coals and that removed the insects. So something to burn really helped.
Well, there was horseflies virtually the size of horses where I was.
Oh, really? They were bigger.
They were really sore, and they really took a liking to me, But anyway, yeah.
Somebody's asking about waking at 2 a.m. and waking at 2 a.m. is a Vata problem. And so you need to balance Vata generally. It's what you do during the day with that good routine, adequate rest, pacing yourself with relaxed meals, taking a day off in the week, doing an oil massage, meditating. These sort of things would be very helpful. There is a herbal for sleep for both Vata and Pitta that might be worth taking before bed, 2 or 3 tablets. And
MA 1684, yeah.
MA 1684. And then there's a question about sleep apnea. And then sleep apnea is the other end of the scale, which is a blockage, which is more kapha. So I think when you have sleep apnea, you need to balance kapha more. And, getting up early in the morning, getting more exercise, doing things that stimulate digestion, using plenty of hot spices. But I'd also use the nasal oil for a month or two, see if clearing the nostrils and the head area eases up the breathing a little.
Yeah, and Jean-Pierre says, I clean my nose with the applicator and lukewarm salty water for more than 20 years every day. He says it's great. He says he never catches colds or sinusitis. So Yeah, I mean it's from the yogic tradition anyway. Yogis do it. They take water up one nostril and down the other nostril and things like that. But it's you know, you don't have to do that. But even just putting the nasya oil in your nose and inhaling it back, it's a wonderful thing to do. I mean, it was one of the recommendations given out by Ayush to help combat COVID, because obviously viruses mostly go in through the nose, the eyes, and the mouth. But if you can keep this area very, very clean and very healthy, then it helps with the prevention of that, you know. So it's just called Nasya, MA735. It's not even expensive. It's a very inexpensive oil, but it's a really, really good thing to do. You know?
Somebody said tripla can cause headaches. Yeah, tripla in the beginning for Vata people can cause little headaches. And some of these herbs are adaptogenic herbs. Sometimes they take time, like ashwagandha and tripla, they need time to settle into your system. You start with small dose and you just to build it up slowly. If it's causing you headache, you probably need to take more water with it, because these are estrogen. Tripla is a very estrogen herb. So that means it would have a drying action on the body. So because of that dryness, it would be leading to dehydration, and that dehydration can cause headache. Otherwise, it wouldn't be particularly directly causing headache. It's just the effect. So you need to take more water if you're getting headache after tripla.
Wouldn't be that common though, I wouldn't imagine, is it, Dr. Richard?
It is. Vata people, it could be because of the cleansing action. That's why we have tripla rose. The rose make it more gentle for Vata people then.
Okay.
So when it's
tripla rose or tripla, it's also called tripla plus, and yeah, they both have rose cabbage in them. They're the same thing. If you see tripla rose or tripla plus, they're from most.
Tripla plus from Puka has trikatu in it. So.
Yeah, I'm talking about Maharishi Ayurveda. Yeah, so Maharishi Ayurveda product, tripla rose or tripla plus are the same thing. Yeah. Here's an interesting question. What does it mean if you wake up with puffy eyes in the morning? For the last 3 mornings, I have woken up with puffy eyes, and that sometimes during the day they go a bit blurry, where I can't make things out clearly. So I don't know if one of you want to take that.
Might be eating too late in the night or the screen time. So you just need to cut on the screen time at least 1 or 2 hours before the bed, and try not to eat too late. So yeah, I'll let others to add into that.
Or watch out if you are having curd or milkshakes at night. So try to avoid those also.
So curd being yogurt, so not
yogurt.
Curd. Yeah.
I take one question about fibromyalgia. So fibromyalgia is basically a vata condition. So what you can do is you need to focus on balancing more of a. You can take oil massage in the morning with sesame oil, or we have a very good oil called vata massage oil, which is infused with a lot of herbs like ashwagandha, bala, which are excellent herbs to balance your vata. You can do nasya in the morning. That also helps to balance your vata. You can take a walk in the morning, like around 20 to 30 minutes. You have diet which are the taste of the food should be sweet, sour, and salty in nature. Have freshly cooked warm foods. Have golden milk at night. You can have ashwagandha along with golden milk at night, because ashwagandha is a very good herb to balance vata. The other herbs can be bala and amla. Amla is a very good spice herbs when you have to balance your, something related to your muscle pain. And you need to also focus on digesting your amma. So amma is a metabolic toxin. So when there is a lot of amma production, so there can be aches and pains all over the body. So for that, you can take a ginger powder, dry ginger powder. You can make a herbal tea out of that with 2 cups of water, half a teaspoon of dry ginger powder, and you sip out throughout the day for a week and see if there is a changes. And if you don't find any significant changes after doing all these remedies, then I would advise you to take a consultation with any of us. Yeah.
There's a question about herbal for optic nerve. Again, like we're looking for a home remedy, which if you're having a deteriorating optic nerve, you really want to look in more generally at your health. But again, we'd be thinking about any nourishment we can get to the herbal, to the nerves generally. 2 herbals that do come to my mind. In general, truffle is considered good for eyes, but there's also a regen nerve herbal. Regen, like regenerate, Regen Nerve. It's MA1674, and that may be worth a trial. And Catherine asks about recurrent breast cancer. I think you're right. It's the best thing there is the consultation you're intending to go for. It's if there was one thing, Amrit Kailash was interesting in that the research done in Amrit Kailash showed, a lot of the different benefits. Amrit Kailash being a general tonic, but there was one research which showed that cancer cells in the laboratory being grown, if there was Amrit Kailash in the nutrients that were provided, then the cancer nature of the cells changed and became less cancerous. So I think Amrit Kailash is probably the best Ayurvedic herbal we could be using under these circumstances, but also the consultation you're thinking of, Catherine.
The question
Doctor,
on...
Go ahead.
Go ahead, Nolia.
No, I'm just noting that Dr. Rajvinder says that the reason the insects were attracted to me is because I smell.
Oh, but insects are more attracted towards Pitta people because Pitta sweats.
They sweat more. Yeah, well, I agree with you. Pitta people do tend to sweat more. Okay.
And the kapha have a sweet smell because of the sweet blood. So I think.
But there's someone there says they've dry vata skin, and it's funny. I walked up those mountains. This was at the bottom of Mount Errigal in the Poison Glen there, and I walked with Declan Dever, a friend of ours, and his brother and myself last year, and I wasn't bitten once. But the brother had to go home. He was being bitten so badly. We didn't want him to go home because we felt he was protecting us from the horseflies. But eventually he just gave up. They were all over him, and they didn't go near me or Declan. But this time I was there on my own, and they just, maybe it's because I was just on my own, they just went mad. But there's someone else there said they dry vata skin and they were attacked as well. So I presume the insects will probably go for what's ever there if they don't have a choice. But
sure. But they attack Pitta more.
They attack Pitta more. Okay, so I have to look out more. There's a spray you can get actually from Forest Essentials. Is it got senna? Is that what it is? Is it? It's. I have it inside actually. It's specifically for mosquitoes. I get it when I go to India.
In the health store as well, they do sell insect repellent spray.
Yeah, but this is a natural one. It's not a chemical one. So it has a. Is it senna, Dr. Brennan?
What's that?
Is it senna that repels insects?
Aparajita is also one of the herbs.
Rajika.
Aparajita.
Rajita. We need to see the English name for it.
Yeah, you were right. That was when we visited in India, a farm that was growing all the Ayurvedic herbals. But they had this trick that among certain very delicate plants, they would always intersperse a few senna plants, because the insects which would come along to devour all these nice delicate plants would happen to nibble at the senna plant. And if they did, they never came back to that area again because of the effect of the senna on them. Because the effect of the senna, of course, is to make it go to the loo. And it works for the insects as well dramatically. So it was a way of preventing them, getting at the good plants.
So I'll take one question. Olivia has asked calf cramp at night. So usually when it is when you get cramps, it is vata disorder. So vata is aggravated. In this case, there are few herbs like ginger and even amla, nirkundi. So you can do a oil massage before going to bed, and even hot fermentation with that. That will give a relief from cramp. Anyone wants to add into this? Do you have any number of oil which you want to suggest?
Joint soothe oil we had.
Joint soothe oil.
929.
Herbal inhalation oil.
Okay.
2 drops of
634. Yeah. Mix it. You could mix it with sesame oil as well, or Pirat balm as well, which would probably be. I have this mosquito repellent here. I've used this. I use it when I go to India, so I haven't used it for a while. But it's just interesting to see the vetiver is in it, basil leaf extract, neem leaf extract, and citronella as well.
Yeah, somebody
and
said
castor oil as well. I found it very, very effective against mosquitoes. I'm not sure against horseflies up in Donegal, but I'll be going up there next week so I can try it out.
Somebody's asking about hogweed burns, and this is a plant that's gone wild in the country, and if it touches your skin and then you're exposed to the sun, you get a bad burn. So aloe vera gel is what I would apply to soothe that. Aloe vera gel.
And someone also asked in the same vein about a sting from a jellyfish.
I think they were advising to apply something like cider on it, weren't they, Noel?
Vinegar.
Vinegar, yeah. Vinegar.
Doesn't work.
no, apple cider. Apple cider.
It doesn't work because I got stung by a jellyfish the other night on my legs, and just actually last night, swimming in Termonfeckin. God, it's painful. And my sister-in-law gave me vinegar, which I put all over the place. All I was missing was the chips now, I can tell you. But anyway, I put the vinegar everywhere, but it didn't take the pain away. It didn't work for me.
Baking soda might work.
Baking soda.
Yeah.
Mixed with anything or just baking soda?
Just baking soda. And just let it sit for a few minutes because it would alkaline the side. And then it's the apple cider. I think normal vinegar wouldn't work.
It's very, very irritating, and she's trying to get to sleep then. It's very irritating. Actually, when I looked it up, it said get a credit card. So this is for anyone that's swimming, okay? And there's lots of jellyfish out there now. So the best thing to do is not get stung. So I have a jellyfish suit which I'm going to be wearing from now on. It's just a t-shirt and a long pair of trousers. But actually, when I looked it up, the advice was to get a credit card and rub it along the affected area, because the little barbs come off and they stick in the skin. And if you scrape them with a credit card, it removes them. Not sure that worked for me either, to be honest, you know. Eventually, I ended up taking 2 paracetamol, which I hate taking, but anyway, I took them because it was so irritating. But apple cider vinegar and baking soda. Okay, I'll have to get them out.
You can even try Triphala decoction wash.
Yeah.
That might help you to reduce the pain in some way.
So Triphala powder with some water. Sorry, Richmond, you're about to say something?
Just cover yourself with castor oil and then go for a swim.
Cover yourself with castor oil and then go swimming.
Yeah, no one can hear you.
Then they'll all stick to you.
But they won't be harmful. Yeah, it was brown jellyfish, somebody asking now.
Yeah, it was a brown. Yeah, the pink ones don't sting you. I mean, the pink ones are fine, but the brown ones, and they're in now. They always come in around this time of the year on the East Coast anyway. And I noticed a lot of them on the beach. And then when I went swimming, I saw one. I managed to avoid that. And I saw the second one. But as I went to go around it, the tentacles, I could feel them pushing off against my legs, on both sides of my legs. Second later, I just had to get out of the water, you know. It's not nice. Anybody that's been stung, it's not a nice experience, you know. So, but I'm not gonna. They're in now, so I'm just gonna wear long pants and long sleeve shirt when you're going swimming. You don't have to stop swimming, but just stop yourself from getting stung, you know. But baking soda, so far we've baking soda, apple cider vinegar, a Triphala wash, and I'm not too sure what else. Just cover yourself in castor oil before you go swimming. My advice is just to cover yourself with clothes before you go swimming.
Yeah, of course. Yeah.
DD is saying that suffering burnout and exhaustion and can't take time out at the moment. Well, DD, the best thing I think you could do is take a nap in the afternoon if you possibly can manage it, even for 20 minutes, just to try and settle this vata, which has gone way out of balance. You're wise to get to bed as early as you can to get the extra rest at night. If you can get a day off to get extra rest in the week. The other thing that's really helpful is the TM, because it gives a very profound rest, which is very refreshing. So it's another strategy. But basically, balancing vata, daily oil massage, if you can do that, gives you a little bit more stamina and strength. So hope this time of burnout passes rapidly, so you can, really get your vata back to balance.
Brian, I've done. Sorry, Naheed, go ahead.
No, you go ahead.
There's still a nice little recipe for an insect repellent put in there by Brian O'Donoghue. So people should look at that if they're interested in that. Eucalyptus oil, citronella oil, eucalyptus oil in a spray bottle with water. So it seems to work there, you know. Sorry, Naheed, go ahead.
So Francis asked, my appetite has increased in the last few months. I am having 3 meals, but still I need to have snacks in between. So what I would suggest for you, Francis, that might be that your pitta has gone out of balance, which is making your digestive fire sharp enough that you're digesting your food in no time and you're feeling hungry again. I would advise you to have Avipatti Churna from our website. That's a very good spice to balance pitta, to bring back in balance, or acid balance to keep your, the pH level and your acid and your pitta and agni in balance. And I would advise you to have all the 6 tastes in your meal. So it can be like you have some rice, dal, some vegetables with some spices, and some buttermilk. So all this taste, all these foods will add all the taste like sweet, sour, salty, bitter, pungent, and astringent. So if you have 6 tastes in a meal, then you probably not to feel too hungry like in no time. And also that do not just have like if you're having meat or something like just a protein on particular meal or just carbs. So try to have like carbohydrate, protein, vitamins, like everything in balance, so that can help you to make fill for a longer time. And make your main meal in the middle of the day, that can be between 12 to 2 p.m., and try to eat most of the food in that time. So I hope you'll not feel hungry like again and again.
The Pitta businessman in me here wants to read out something from Florence, and it says, thanks so much for the 4 doctors, Dr. Brennan, Dr. Raj, Dr. Naheed, and Dr. Telly. So wonderful and generous of you to give us so much of your time. I have missed these Q&As. Thank you again, Noel, for organizing this one. Ayurveda has changed my life. I had a consultations with Dr. Don and Dr. Raj, who have been amazing with help and guidance, and my health problems have really improved. I would advise anyone to book a consultation with one of the doctors. It's so worth it. They are very kind and considerate, and their knowledge is invaluable. So thanks very much for that, Florence. It's very nice of you to say that. And yeah, there's nothing, I mean, these sessions are great. People get kind of an understanding of the depth of knowledge that Ayurveda has. I don't think there's ever been a case where we haven't answered a question. We certainly don't purposely, we might miss out on some questions, but they're not because on purpose. It's just because there's so many questions coming in. So sometimes, I mean, I was up, unfortunately, my mom is in hospital, and I was up in the hospital a while back, and there was an Indian nurse attending my mother, and she was a fantastic nurse. I told her I worked in Ayurveda, and she knew nothing about it. She said, oh, it can be good for back pain. That's all she knew about Ayurveda. She didn't really know anything else about it. And like, that's really a shame. So people just think it's some tiny little folk medicine or something like that that's not applicable to serious conditions or anything like that. But as you can see from the way the doctors have answered the questions here, there's a depth of knowledge in Ayurveda that, as far as I'm concerned, goes beyond anything that any other system of medicine has to offer, So it's a huge expanse of knowledge. And you're right, it's all about knowledge, and it's all about using that knowledge, So thanks very much for posting that, Florence.
Hello, everyone, and thank you, doctors, for your advice and guidance. Great knowledge you're sharing. I had trouble with all 3 doshas a few months ago, and thanks to your advice and process of purification and purgation, I could overcome these imbalances easily. So there's another, that's from Muin. Thank you for that. It just shows you people who take on board the Ayurveda, even from our seminars, they make huge changes in their well-being, which is great. It's very reassuring. It's why we do it. It's very fulfilling.
Okay, so listen, we're nearly getting to the end of things here, and I just want to do a few little things before we go. I just want to share my screen for a second, because I want to bring you to our website, okay? So our website is ayurveda.ie. So you can see the spelling of Ayurveda. You can see the website, you can see the screen, Don?
Yes.
Okay, so ayurveda.ie, that's the spelling. Ayu meaning lifespan and Veda meaning knowledge. So ayurveda.ie, okay? And if you go to this menu here, services, and then you click on online Ayurveda course, okay? And that brings you to this page here. And this page is where people can register for our 7-lesson course. Now, this is not a live course. These are recordings that we did throughout last year and the year before. So we've selected 7 of the best lectures that we did. And basically they're an introduction to Ayurveda, an explanation of Vata, an explanation of Pitta, an explanation of Kapha, the rhythms of nature, which I spoke about quite a bit today, digestion, and then the 6 stages of disease. And that's the fundamental course that we want everybody to do. This is the basic introduction that people have to Ayurveda. It will give them a great overview of what Ayurveda is and, you know, what it's capable of doing. And this is the page where I want you to send all your family and friends to, okay? Because this is where they can learn about what this course is. And then they just click on the register now button. And then when they do that, they're just asked for their email address, their first name and their last name. So this is also the first post on our Facebook page. So if you're a Facebook user, go to our Facebook page, which you can get to from our website, okay? Down the bottom of our website, you can get to our YouTube channel and our Facebook page. Go to that and then share that Facebook post about this particular course and share this with your friends and families. As I say, this isn't a live, so what happens is they get sent 2 lectures each week. And then by the end of the 7th lecture, they've done the whole course. And then what we want to do is invite people onto these Q&As. This Q&A this evening, we've spent about an hour and a half answering questions. If we have to play the video on Vata, Pitta, or Kapha, that takes up 40 minutes, 45 minutes. I think it even takes up an hour sometimes. And then there's only 30 minutes left for answering questions. So the reality is people can look at these videos. We've done them. There's no need to have the doctor sitting there while we replay a video. People should just watch those videos. I'll be advertising them on Facebook, on Instagram, on YouTube, all of those places. Get people to watch that course. Tell your friends about it. They can just watch it on their phone, on their way to work or whatever like that. And then when they register for the course, obviously we get their email address and then we'll invite them along to these live Q&As. And I think this is a much better way of making best use of the doctor's time. Because rather than the doctor sitting there for 45 minutes while a video is playing, people have already watched the videos, and then we can get the maximum amount of knowledge from the course participants. The other thing I just wanted to say is at the moment we're running a sale, so most of you would have gotten that information in the email. So just use the voucher code HOLIDAY with a capital H, and we've 20% off all our products in our shop. And the easiest way to find anything is use the search bar here. So let's say you're looking for MA735. You just stick it in there into the search bar, and then MA735 comes up, and you have that's the nasal applicator one, and that's the refill bottle. So let's say you're looking for Blissful Joy, and you don't know what the number of it is. So you put the word blissful, and then anything to do with Blissful Joy will come up, okay, or anything to do with the word blissful. So you see we have Blissful Sleep Basic, we have Blissful Joy tablets, and then you can click on them and read the ingredients. So that's the easiest way. We've so many products. If you go to the shop, you're going to find it very difficult to find out exactly where the product is. So the best thing is just to put it into the search bar, and then all of our products will come up. And then obviously when you go to the home page, we have the booking details for all of our doctors as well, as on the booking page. And we have to put up Dr. Chirtelli as well. So we'll be doing that in the near future, you know. But the real thing I want to get across is to get this 7-lesson Ayurveda course. It's an absolutely brilliant course. We've had over 20,000 people register for the course in the last year, and we want another 20 or 40 or 60,000 people doing it next year. But the best way to spread it out is through word of mouth. So you can pass that link on to all of your colleagues and friends, or do up a poster about it and put it in your local shop. We have Ayurvedic ambassadors. We've got quite a lot of Ayurvedic ambassadors. That's people who have seen profound changes in their life from the use of Ayurveda, and they're very keen to help us promote it. So we want everybody to become an Ayurvedic ambassador. You know? So
no, there's questions there about when's the next detox, and what about your yoga classes?
Okay, the next detox, we're going to be doing a talk about that in the beginning of September, I think it is. And the actual detox itself is going to be starting on the 24th of September. It's not going to be the same detox as the previous one because it's a different season. So it's more a Pitta orientated detox. We haven't got all the details yet, but we will get all the details, and we will send that. Make sure you're registered for our newsletter, and make sure you add noel@ayurveda.ie. That's me, noel@ayurveda.ie. Add me to your contacts, and that way my emails don't end up in your spam folder, because we have a huge mailing list. And then what happens is that Google sees, hang on, these people are sending this out to 15,000 people. It must be spam or something like that. And then it ends up in your spam folder and you never see it. So if you add noel@ayurveda.ie to your email list, then more than likely it'll end up in your inbox there. But make sure you're registered for our newsletter. That's the only way to keep in touch with us, really. I send newsletters out every week, at least every week, with fantastic articles from all the doctors and keeping you informed of webinars and all different things. Yeah, so keep in touch that way. But we will be doing a detox in September. And if it's anything like the last one, we were massively oversubscribed the last time. So we'll just see how it goes. It's a different type of a detox that involves drinking ghee and stuff like that. But we will explain everything about it. But the feedback we got from the last detox we did, I think it's the most positive feedback we ever got from anything we ever did. I think Dr. Rajinder would agree with that. I mean, we just got, I mean, the changes that people saw from actually putting this into practice over the 10 days of the detox. And this next detox will be about 2 weeks long. And they were just phenomenal, you know. So yeah, what about the yoga classes, Chris? Very good point. We needed to take a break. We were just doing stuff all the time. So we will go back to doing the yoga classes. Maybe we'll make one of the yoga classes a pre-recorded one available. We haven't done that up till now. We might make one of them available, but I'll be talking to I'll talk to Dr. Rajinder. She was the real lead in the yoga classes, really, and the yoga nidra and the pranayama. And I think at one time we had 450 people on a yoga class we did, you know. So we will definitely go back to doing that, but it won't be in August. It definitely won't be in August. We have to live by our own Ayurvedic principles as well, and that means if you push yourself really hard for 10 months, then take a little time off, you know. So come September we'll start those back again. So there is detox course, an online course. It's a course that you do at home that you're fully supported with, and we send out the pack and the ingredients. But you have to. We don't take everybody on the detox course. There's certain requirements to be able to go on the course. We will be doing a live webinar on it at the end of August or beginning of September. We will send a link out to that. You have to do that webinar before you even consider doing the detox, and then we'll lay down the criteria, costs that are involved, what's involved in it. And then the last time it was booked out by the end of the webinar, but maybe the same will happen this time as well. But we'll just see. But that's the way it is, you know. Jennifer says, thank you all. I first came to see Dr. Brennan in 2014, and it was a huge turning point in my health. Ayurveda is so empowering. I wish more people knew how amazing it is. I will be sending people to your website. So that's what we want. I can go and spend a fortune advertising this on Facebook, but people are seeing it. They haven't heard of Ayurveda. They don't know anything about it. It's very difficult to get through to people that way, in a cold way. But if you have a friend that comes to you and says, I did this and I found it really good, here's a free 7-lesson course that you can do. And really, we don't want people engaging with Ayurveda in a very, you know, we want people to engage in it in a serious way. And what I mean by, I don't mean serious as in, you know, what I mean by serious is that they do the course so they can see the depth of the knowledge. And when they see the depth of the knowledge, then they make the changes and they live the lifestyle. It's not just about taking a tablet or something like that. This is life transformative. So we want people we want to get this knowledge out there in the best way possible. So do tell all your friends about it and everything like that, and all your family and everything. You know? The last detox was fantastic. I would definitely love to do another. Okay, and then thank you to all the wonderful doctors, such valuable information as always. So we're going to end because it's getting to 9 o'clock. So we're getting to that time of the day where it's time to start winding down and getting off the screens. So it was a great pleasure to introduce Dr. Chitali this evening, and I'm sure you're going to be seeing a lot more of her in the future. A big thank you to Dr. Rajvinder. She's so full of knowledge. She's incredible knowledge that she gives out. A big thank you to Dr. Naheed for joining us from India, way past her bedtime, so she has to go and get proper sleep. And hopefully we'll see you back in Ireland sometime soon, Dr. Naheed, and the people down in Cork can take advantage of your great knowledge. And then a huge thank you to the father of Ayurveda in Ireland, which is without doubt Dr. Don Brennan. I don't know whether you're the grandfather, the father, or the great-grandfather, but you're definitely the inspiration for us all. So thank you for coming along.
Noel, I could be tottering towards my grave in 3 decades' time, and totally unfulfilled if it weren't for you actually making it happen and getting us out there. So it's fantastic, your work. It's really bringing Ayurveda to the country, which is what we really want to see. So welcome you and thank you. And thanks everybody for your lovely, encouraging comments. It's very uplifting that you give us that feedback and keeps us very happy. Thanks.
One of you is father and one of you is a grandfather.
Lauren says, don't be so cheeky.
Yes.
She says, Dr. Brennan is so young. Well, he is so young. That's true. So, but we do want to get this knowledge out there. That's why we're all doing this. That's what we're all interested in. And really the best way to get it out is through you and through your experiences and everything like that. So, and it's great. We had over 200 people on the call this evening, which for, a day in August is, that means we'll have 500 or 600 people on when it comes to September. So big namaste to everybody.
Thank
you very much.
And thank you.
And it was great to meet
Thank
up with
you.
you again. We hadn't seen you for a while. As I say, a big thank you to the doctors, a big thank you to everybody coming on. I'll put this on YouTube. I'll send you an email with the link. I'll send you details of the sale if you haven't already got it. Give me a chance to get that out. Give me a day or two to get that out. Then you can go subscribe to our YouTube channel. Lots and lots of videos on our YouTube channel. So you can go through them. But this one I'll put up on it. But give me a day or two. I'm myself and Dr. Brennan are doing a bit of walking tomorrow, and I'll get around to sending it out in the next day or so. So thanks very much, everybody. Bye bye. Take care.
Bye. Thank you.
Nice. Thank you.
Thank you.